So, moving into our next presentation, I'm very excited. We started off with that dynamic presentation from Mr. Gary Williams, and our next presentation will be on the family dynamics of kinship care and behavioral health issues. So we all know as kinship parents, there can be some challenging times, there can be some trying times, and we might need resources and assistance in terms of behavioral health, mental health, addiction services, other mental health resources in the city. So I am pleased and honored to introduce our presenters for this next workshop. We have Mr. Andrew DeVos, Director of Member Services at CBH, and Robert Jimenez, who's also been working with CBH and the Department of Behavioral Health Intellectual Disability Services. Both will be joining us for the next presentation, and I would just like to take a minute to introduce them. Andy DeVos has worked since 1996 at Community Behavioral Health, which is the behavioral health managed care organization that is a component of Philadelphia's Department of Behavioral Health and Intellectual Disability Services. In his current role as Deputy Chief Operating Officer, Andy oversees both the member services and provider organizations departments. His education includes a bachelor's degree in English from Messiah College and a master's in secondary education from Temple University. Mr. Robert Jimenez Jr. has been working in the behavioral health field for over 30 years and is a member of the Department of Behavioral Health and Intellectual Disability Services. He is currently serving as the public health liaison for the department, and some of his duties entail working with the planning and implementation of reports on various programs, initiatives, and events for DBH-IDS. Robert works closely with community partners to promote awareness and knowledge of the DBH-IDS public health approach to wellness. Other aspects of his role are to strategically find ways to be more effectively engaged in developing and promoting DBH-IDS community linkage and outreach efforts. Without further ado, I would like to introduce Mr. Andrew DeVos and Robert Jimenez. Thank you, gentlemen.
Good morning. Can everyone hear me clearly? Thank you. And thank you, Carly. And I want to thank Gary for his presentation. Very informative. Again, my name is Bob Ximenes, and my co-presenter today really needs no introduction in the kinship care field, Mr. Andy DeVos. I've known this man for over 17 years, and he is the walking authority. He is the man. I'm just a setup man. What we want to do is basically, I'm Bob X, and that's Andy. We're pretty much matter of fact. This is going to be an informative, but hopefully it's going to be an education and exciting time for you, because we're just going to highlight some information. We're going to tell you a few things, and at the end of it, if you have any questions for Andy and myself, we'll be around. And also, we have a table outside with two of our people who will be representing the Department of Behavioral Health and Intellectual Disability Services. With that, I want to tell you to take a look at this picture right here. The dynamics of family, dynamics of kinship care. When I look at this picture, I see what could possibly be a mother, father, grandmother, grandfather, could be an uncle, could be an aunt. I see a child. I see a loving, caring environment. When I look out in this audience right here, this is you. This is you. This is what you do on a daily basis. We got a clicker? Clicker. I don't want you to answer this, but I want you to think about this, and I want you to take a look at this and ask yourself this question. Go back one. I'm sorry. The day that I decided to become the primary caregiver for my family member, I felt, and I want you to fill that in. I want you to just to think about that and think about what that time period was like for you and what emotions and what was going on with you. I'm going to divert a little bit. I'm going to tell you a true story. It's only going to take a couple of minutes, and I promise hopefully it doesn't bore you. There was a family, and this is a true story, that lived right around the corner, 123 South 50th Street. Well, that's the corner of 50th and Sampson Street for those of you who know the area. The family consisted of a mother, a father, a grandmother, and initially one son. The mother and father were great parents, don't get me wrong. They worked long, tiresome hours, and they weren't always there. The grandmother, however, was the consistent factor and the glue that held that family together. It's what time now? It's 10:45. This grandmother, for the most part, fixed breakfast. She fixed dinner. She did the baths. She helped with the homework. And she had all of this done by the time either the mother and or the father came home. It's Saturday morning, it's 10:45. This grandmother already had, at the time it was one child, and then the family grew to 2 children, 2 boys, and then she adopted 2 girls. By this time, the 4 children and grandma would have left 50th and Sansom on a Saturday morning. They would have walked up to 60th and Market. There was a church or a chapel or something there, and she used to go into and light the candles and say her prayers. She would do some shopping up there. They would walk back down to 52nd and Market, where 2 or 3 things happened. The boys would be able to go to Woolworths, and grandmom used to buy them Big Army Men or whatever it was for the kids to have something to play. The girls would get whatever the girls got, whether it was something for their hair or something to go with their clothes or what have you. She would stop at the fish market underneath the L stand, y'all know what I'm talking about, and get her fish. And I think at that point, anything else, I think there was a grocery store. I don't know if it was A&P, is that what it was? I don't know what it was. Okay. And they would do some shopping and go home. I tell you, this grandmother did this on a daily basis. As the family grew, they moved from West Philly, they moved up to Winfield, Upper West Philly, and the parents divorced. Again, the one thing that was constant in this family was that grandmom was there. Now, I'm going to tell you the truth. That is the best woman, the best lady that I ever had in my life. And I don't think that I turned out too bad. My grandmom was all of that. And I say that to say that before we go any further, if nobody else tell you they love you today, Bob X loves you today. All right. Enjoy. But what if my loved one experiences emotional or behavioral challenges that feels like more than we can handle? And that's where we come in. We do the behavioral health. So a lot of times, you're not expecting that because you weren't expecting to take over the family that you took over. So when you get these kind of challenges, I just want to let you know that as we go on, that you can do it because there are resources that are available for you. All right, what are our objectives for today? We want to provide the background on how CBH, DBH, that's who we are, how it works. Learn more about the types of services that are available for you as it relates to behavioral health services. And for a clarity, when I talk about behavioral health services, we're talking about mental health services and substance use services as well. That's what we do. That's what behavioral health is. Drugs and alcohol and mental health. And we're going to talk about how you can access and get the most from these services. At this point, I'm going to go ahead and turn it over to Andy. And like I say, we're just going to be matter of fact. We're going to come back and forward on this. So here goes Mr. Andy DeVos.
Hi, everybody. He said I was the man. He's the man, isn't he? What do you think about? Great story. Love that guy. So we're here to talk about behavioral health resources or tools, things that can really help your loved ones, yourself, and your family. But that's really what they are. One of the things we talk about in behavioral health care is, especially with kids, having a strengths-based approach. Have you ever heard that? What are the strengths, though? One is sitting right here in this auditorium today. You all feeling strong? Let me hear you. Feeling strong? Services come and go. Families forever. I loved what Gary said about kinship. I love that word, kinship. But as Bob was talking about behavioral health, really being mental health care, drug and alcohol care, there are times when some of those services really become crucial. Now, when you talk about mental health care, it's interesting because it's that nature versus nurture. Some of it comes through biology. Some of it really is things that people are born with. There are certain mental illnesses that come out in someone's life. I heard someone talk about autism, which isn't really, it's more of a developmental disorder, but that comes out of biology. Something like schizophrenia. For kids who have true, what they call ADHD, attention deficit hyperactivity disorder, there are kids who are truly just wired that way. But within, especially in the child welfare system, there's also what happens to you in your life and how you respond to that. And many times you see children who are responding to things that really, some of the resources that may help them are under mental health. But I don't know about you, some of the responses are really, to me, they're normal. Kids don't have the language to be able to talk about some of the things that happen to them. So if they've been in situations where neglect has been present, the big word that's in the system now is trauma, where children face trauma. That may be violence they've been exposed to. That may be abuse they've been exposed to. Could be physical, sexual. They're going to respond to that often behaviorally. So when a lot of the services that children receive are really, could be in response to something biologically that's happened to them, or really situational things that have happened in their life that they're responding to. One of the key things we believe, though, why we say strengths are so important, is, see that word resiliency or resilience? That just means they bounce back. I am amazed how resilient we are as human beings, and children themselves. You've seen it with the kids under your care, how they keep bouncing back. So that's a key component of that. And the power of families, that's why we're here today. So let me tell you a little bit about what is CBH. How many of you have heard of CBH or community behavioral health, just by show of hands? Okay? So we're part of a bigger organization called the Department of Behavioral Health and Intellectual Disability Services. That's the city department that we sit within. But CBH itself, we don't like to use this term, but we're kind of like the insurance company for behavioral health. We do a lot more than that. We basically pay for the services, but we also help link up, coordinate the services. If things aren't going well for you, there's a key phone number I want you to see in a minute. If you forget everything else that we say today, that's the most important thing. Where can I turn? My behavioral health services aren't what they're supposed to be. But how big is the scope of that world that we're talking about? CBH, so when people get medical assistance or Medicaid, as it's called from the federal government, but it comes through the state. When people sign up and get that insurance, in Pennsylvania, they're really getting two insurances. They're getting physical health insurance, so that's managed by places like Keystone Mercy, Health Partners, but then they're also getting behavioral health insurance. So we're, if you will, the insurance company for that. How many people in Philadelphia are in that system, the medical assistance system? 550,000. So we're a city of not quite 1.5 million people. Over a third we're talking about, and over 200,000 of them are kids. So that's kind of the world that we're talking about. We at CBH don't turn people on or off of medical assistance. That's done by what used to be called the Department of Public Welfare. They changed their name to the Department of Human Services to make things really confusing. So now we have Philly DHS, now we have the state DHS. But if you're ever having trouble with insurance eligibility, if you see that number 215, well, the first thing, if you're attached, as Gary was saying, to a single case manager, that's your first place to turn, through DHS. But if you're not involved with DHS, as the questioner was able to talk about earlier, and you may have questions about insurance eligibility or other things, that number, 215-560-2547. Now, this is the number that I talked about if you forget everything else. If you have a pen, write it down. But we also have our resource table with a lot of stuff out there for CBH. 1-888-545-2600. That's a 24/7 number that people can call for behavioral health linkage assistance. So if you don't know where to go, if your child has started to show some emotional disturbance, or someone from the school said, they seem sad or depressed or fighting a lot. Remember, kids often show things through aggression that's really going on inside themselves. You don't have to call in. If there's a behavioral health provider you've had a relationship with, many of them will be out in the foyer later. But if you know where to go, please call on your own. There's nothing to stop you from that. But if you need any help or guidance, that's your phone number. Now, the other thing that number's for is if you're in services, but they're not really going the way that they should be. And if you're struggling with the provider, contact information. We love our providers. We think we have a lot that provide wonderful service to children in Philadelphia. But sometimes you need advocacy. That's the other thing that we do. This is always answered by a live person, 24/7. Okay, sure.
Also on this note, if by chance you really don't know what it is you want to ask, call this number. The member service representatives on the other side of their phone are trained to answer questions even if you don't know what it is you want to ask. It might sound a little crazy, but that's what they do. They do it very well. If you just have a question about anything that's dealing with behavioral health services or something that you were thinking or something that you heard, any time of the day or night, a live person will answer that telephone. That's the most important thing about that. So even if you don't even know what you want, call the number.
Thank you, Bob. That's hugely important. I will say behavioral health or mental health care or mental wellness is really tied to your overall wellness. It's really something in the last couple decades, there's been a lot more talk about it. Thank you, Oprah. Oprah is somebody who likes to talk about wellness, and she likes to talk about mental health, and some of her crew, like Dr. Phil. But sometimes there's still stigma involved. You want me to take my kid to a therapist? I don't know about that. I got some questions. That's a place that you can call. The one area that there's less and less of this because we're under Medicaid expansion in Pennsylvania, so more and more people are covered through insurance. But the one place that member services at CBH does not cover within the behavioral health world is if somebody has no insurance and needs drug and alcohol treatment. So the one other number I wanted to highlight for you is the Behavioral Health Special Initiative, 215-546-1200. If any loved one does not qualify for insurance, does not have insurance, but really needs treatment, everything from detox or rehab down through outpatient treatment for a drug and alcohol addiction, that's the place you can call. Yeah, we have an excellent working relationship with them. We really work hand in glove with them. So, once you get referred into a treatment provider, what happens? You bring your child in. The main thing that they're going to do right off the bat is an assessment. Just like when you go to the physical health doctor, they're going to ask you questions about what's wrong, what's right, your overall health. That's really what the assessment is. And it's maybe done by a psychologist, maybe done by the psychiatrist, but that's really the first step in the process that really gets the behavioral health treatment started. What they're going to do then is listen to how severe the issues are, what they are, and they're going to develop a treatment plan for the family. And what they're going to do is try to fit the services precisely to what you and your family need. So this is just kind of the menu, if you will, of some of the services for children and families. I would say most families in Philadelphia are treated through outpatient clinics. We have over 100 outpatient clinics between mental health and drug and alcohol services in Philadelphia. And that's where somebody might go once a week for the child themselves, or it's always best when the family is involved and treated together. But you can see there's a continuum of services, and some of them are more intensive. I hate to think about children going into a psychiatric hospital where they have to stay overnight. maybe for a week or two, but it does happen. Sometimes because of what they've seen, or if they have an emerging mental health problem themselves, their behavior problems are so severe at that time, they may have to go into the hospital. That's the highest level of treatment. And then you have a number of services in between. One of the ones that a lot of kids end up getting is something called behavioral health rehabilitative services. Some people call it wraparound services, BHRS. That's one of the other items on the menu that you see there. Okay. And just to tell you, kind of in scope in the city, how many children are in treatment in a year? Over 30,000 kids in Philadelphia will receive some type of behavioral health service. All right, I'm going to stop here because we've been talking for a bit. This is an issue that we know that people tend to have questions about. So up to this point, any questions so far or comments? Anything you would like to raise or add? Yes. Okay, I have a couple thoughts on that, and then Bob might have a couple, and then if there's folks from the DHS realm, they might have some thoughts on the custody especially. So one thing about behavioral health services, an interesting law in Pennsylvania, children can actually sign for themselves to receive treatment starting at age 14. So if a child's 14, now if the parent's still involved or the guardian, the legal guardian's still involved, because family therapy is always better, they're going to want them to be included. But children can sign for their own behavioral health care starting at age 14. In this situation, I think it's always wise to establish some type of legal guardianship for these children, especially up until they're 18 years old. Mm-hmm. Back to the issue regarding the cancer, and I'll give you my card when we're done. There's a number of support groups for both children and adults when a loved one has a chronic illness. Okay.
Ma'am, LaRue, raise your hand. See that gentleman in the back right there, ma'am? Stand up, LaRue. That gentleman right there, he's going to be at the resource table outside for community behavioral health. Make sure you stop by the table and talk to him. But as Andy said, he can tell you basically what you can do, and you can call in so they can check on the services, because it sounds like the child is already receiving something, some kind of way. Right. And also check with DHS at that table.
Okay, other questions that people have or comments at this point? So one of the things that we feel like is most important, and Gary did talk about this as well, is that ideally the treatment be provided in the most natural setting for the family and not to remove kids out unless as a last resort. There are times when kids, some of their behavior is severe enough, or the emotional disturbance is severe enough, they may have to go to a residential treatment program and stay away for some period of months. But for the most part, we really try to have partnerships throughout the city and embed the behavioral health services right in the community with you all. Because at the end of the day, that kid is eventually going to come back to the community, eventually going to come back to their family. But we also try to build bridges across different parts of the system. So we've done that for years, especially with the Department of Human Services. And what we do find is many of the families, not all, but many of the families who do become involved in the child welfare system have significant behavioral health concerns. It could be addiction within the family member. It could be a mental illness in the family member or the parent, biological parent, that has either caused them to be absent or provide less than ideal care for their children. So one of the things that we do as part of, as Gary was talking about, really the different types of meetings, we now have CBH staff right over at family court in each courtroom to help advise really on all families that hit family court. So part of the meetings, the pre-hearing conferences, the 20-day meeting that Gary talked about, if a therapist is involved, we urge you to really invite that person to be a part, take part. If you're having trouble getting the behavioral health provider to be a part of that, that's another time that you would call us. Some of the other ways that we have really partnered with different parts of the city system is behavioral health in schools. So we now have what are called school therapeutic support programs within many of the schools. We have a brand new type of model we're piloting in 5 schools this year, which is a child and adolescent program. But what we try to do is have providers matched up with specific schools so that as they start to see behavior problems within the school, they can really try to address those ahead of time before they get worse. More and more, within physical health care, we're having behavioral health specialists within a physical health setting. There is still a lot of stigma around behavioral health, and some people just don't want to make that referral. But they may be suffering from depression. Parent may be suffering from depression. And they may be talking about it with their primary care doctor. We now have in all of the federally qualified health centers and in all of the city health centers, we now have behavioral health, usually psychologists, who can be a part of that team. And then one of the places that we're partnering with that many of our folks flow through is the Philadelphia prison system. Okay, this is kind of our worst case scenario page, but it's an important one. If there's a mental health crisis, how the city is set up is they have 5 crisis response centers that are open 24/7, 365 days a year in different geographical sections of the city. There is right now just one for children, and that's Einstein, which is at Germantown Hospital. But we're looking in this coming year to actually change a bit of the children's crisis system and possibly have a second crisis response center for children. The other ones really are 24/7 places where any individual can walk in or a family member can walk in. If their family member is in crisis, even if that family member is not with them, sometimes the family member will go on their own. We don't, nobody likes to see it happen this way, but sometimes people have to be involuntarily committed for psychiatric care. That can also be done through the crisis response centers. So you'll see they're located. Hall Mercer is in Center City at 8th and Locust. Mercy Crisis Response Center is one out here for West Philly. And then Temple in North, and then Friends for the Northeast. This other phone number, I gave you the CBH phone number. Again, if all else fails, just remember that one. That can be utilized for anything. But there's also the mental health delegate number, 215-685-6440. Those are for mobile emergency teams. So there are times when a situation is so pressing or so maybe emotionally volatile that having a mental health professional come out, even to the home, within an hour or two, it's that important. That's that phone number, 215-685-6440. Yeah, that's just the same. Okay, we're also, I mentioned that CBH, Community Behavioral Health, is part of a larger system called the Department of Behavioral Health and Intellectual Disability Services. Now, we've been talking a lot about the behavioral health portion, which again is mental health and drug and alcohol services. But the other part related to brain function and development is called intellectual disabilities. Now, this is a word that we prefer a lot more now, but really what this used to be called is the mental retardation system, or MRS. You may have heard of that in the past. And so this is for people who have significant developmental delay or disability related to their cognitive functioning. And these are just some key phone numbers where if you see that a child under your care is experiencing a significant developmental delay, Again, a main number to call and a great place to always check first is the bottom phone number, 215-685-5900. That's the general information and intake number at the city's intellectual disability services. Another important one is ChildLink. So if your child is up to age 3 and you start, they're slow to walk, slow to talk, some of their motor skills are off, and you want to have them assessed to see what is that level of developmental delay. That goes through ChildLink, 215-731-2110. And then for slightly older kids, a provider called Elwyn is the provider of services for all of Philadelphia County for what's called the Early Intervention Program for kids aged 3 to 5. And that's that same type of thing where if they're having developmental issues around, including emotional development, but really physical development, fine motor skills, gross motor skills, slow to talk, slow to walk, and they may receive a variety of services from there, everything from speech therapy, occupational therapy, they provide services for a number of children with autism. So those are some important numbers on intellectual disabilities services.
All right, so this is basically concludes the PowerPoint presentation, but I just want to draw your attention to this right here. You've made the right decision for your loved one, even as the journey continues. By no means is this conference a stop-all to all the questions, all the concerns, all the emotions that you feel on a daily basis. We understand that. Our intent is to at least point out to you that there is support, there is help, and there are people who are in this struggle with you. I consider myself a soldier. I'm a soldier. I've been doing this for a long time, and this is what I do. But I can't compare to the age and the years of services that I see as I look out here amongst all of you. Y'all folks have been doing this. It's probably as long as my grandmother was doing it, God rest her soul, because she was taking in any and everybody, and she did a heck of a job. So go ahead and give yourselves a round of applause for the work that you do and the work that you continue to do. And please, if nothing else, we know it's a lot of information that was up here, but trust me, all that information is in the handouts that we have at the table out there. So please make sure you stop and pick up some of that literature. So at this time, we still got a couple of minutes. Any questions that you may have? Yes, ma'am. Okay. You believe that this individual parent / caregiver has some sort of a mental health history, right? Okay. What part of the city do you live in? Okay, the person lives in South Philly. So that would have to be Hall Mercer? In the information that we have out there, and the numbers that we showed up there, where there was a Hall Mercer located 8th and Spruce? No, whatever it is, you would have to go into them and you would have to file a petition, which is the 302 involuntary petition, and they would have to take it there. Now, what they're going to ask you is, have you witnessed and seen this behavior, quote unquote, within the last 30 days? And then they will write your story out, your statement, and then they will go ahead and investigate that. Again, that information is in the literature that we have out there. And again, the gentleman and the lady at the table, they can talk you through that and walk you through that and let you know what you need to do. Okay? Sure.
In addition to the mental health services there, if you believe that a child is in danger, then you do have another moral responsibility, or if you're in the field where you're a mandated reporter, you have a professional responsibility to report that you believe a child is in danger. So there is the aspect of getting the parent help. There's also another aspect of making a report if you believe that child is in imminent danger. You can call 911 if the incident is happening at that moment where a child is in danger, you can call DHS hotline with the numbers that Gary put up earlier, or you can call the local CUA for some less formal assistance or to help gauge how imminent this danger is. For the South Philadelphia, the CUA would be Beth Anna, and they have a table outside as well, too.
Thank you, Carly. This lady in the yellow? There's a couple of things you do, and Carla will probably tell you as far as the CUA representative, but anytime there's an issue with services that you receive from anyone, you can always contact the member service number, which is the number that 888-545-2600, and let them know what you're experiencing. Now, if it's a direct CUA response representative person that you know that's coming in, I think Carly can tell you what you can do with that.
So 2 things to respond to that as well, and I'm very glad that you asked that. At the DHS table outside, there is a number, there's a little postcard that you can get for CARO. It's C-A-R-O. It's an acronym for customer complaint and customer assistance line. So it's a DHS entity that's separate from the CUAs. So if you're struggling with a CUA worker or CUA provided services, you can call DHS and ask for additional assistance, report the problem, get a mediator, those kind of things. You also, if you're directly involved with the CUA, should have access to a chain of command. So if you're struggling with a worker or a case aide, as usual, make sure you have things in writing if you can. Make sure you have your documentation, your proof, your dates. Go up the chain of command. Everybody has a supervisor. The supervisor has a supervisor. I work in a CUA. If you have a problem with me, I want you to go to my supervisor because I want your children to benefit. So even though that one worker might take it a little personally, might be upset, we're about the children. And if you need to say something on behalf of that child, it is absolutely appropriate to get the appropriate assistance that you need. So if you have any issues where you need contact information for CUAs and administrative teams, visit those tables outside, but make sure you stop by the DHS table and get that CARO card, C-A-R-O. It's for your customer assistance with DHS and CUA-related problems.
I was just going to say all that information, including all of the CUA information, including the community behavioral health contact information, is in your local resource guide as well. So all this information and contact information are in the books that you have, as well as you can get additional information from the different resource tables. Thank you.
I think I saw one hand back there, and this is going to have to be the last one, but again, I'll be around, so any questions you have for me, I'll be around for a while, as well as the people at our resource table. But ma'am? I'm glad you asked that question, because I can answer that question. I feel good. Unfortunately, let me start off by this. I have a lot of faith in our police department. I know quite a few police officers, and I know a lot of people are trying to do the right thing. Unfortunately, there are always those, and no matter what line of work we do, that maybe just don't quite cut the mustard. They don't get it right. They don't do the right thing. We have a training department, and we have a lady that I know personally, and she works in, it's called the CIT. The CIT, right? Community Integration Training or what have you. And I don't know the numbers, so don't quote me, but to date, we have trained over, I want to say it's over 1,000 police officers in handling mental health situations / emergencies, to in fact that if you are having one, when you call, you can ask and request the police department to have a CIT trained officer come out to investigate. So is it perfect? No, but I'm telling you, we're working with the police department every day. We have over 1,000. Like I said, my numbers might be a little off, but it's at least 1,000 officers who have been trained, and you can request one to come out. I think it's CIT.
Yeah, CIT basically grew out of that response. And, police officers, I'm not going to defend somebody who you had a bad experience with. They're asked to do a lot of tough things. They're the ones who have to respond around the 302s, the involuntary commitments. So we really heard that complaint regularly about how things were handled. In addition to the CIT, which is specifically for the police, one other thing that we do is something called mental health first aid, where we have trained several thousand individuals around the city around mental health first aid. That's not to make them therapists or psychologists themselves. Really, it's just to help them understand what they see when they see somebody with a mental health challenge. And what we did is targeted that toward places where our folks traditionally have trouble interacting, either getting thrown out of places. So it could be libraries. A lot of people with mental health challenges like to go to the library, and many of them who may not have things to do during the day. We've trained many people in the libraries. The fire department, police department, rec centers. That's all our target group for mental health first aid, to really try to help just the general public understand when they see somebody with a mental health challenge, they can respond with compassion and understanding as well as whatever else is needed. So, yep. One more? Yes. And I can't remember what the acronym is, but it's really a partnership between the Department of Behavioral Health and the police department for them to be trained to understand mental health challenges, somebody who's in addiction but acting out behaviorally. So they maybe don't go strong arm first tactic. Yeah, CIT. Yeah. And I'm Andy, that's Bob. If you look up Community Behavioral Health phone number, if you want to call us and say, what is CIT? We can look it up when we get back. Yeah, but it was really straight out of that concern. So, well, thanks everybody. We want you to be able to have a little bit of a break time, so I don't know if we can.
Join me for thanking both Andy and Bob one more time. So.